Hi, everyone. Dr. Paul here from the Eastern Ontario Health Unit, once again with a weekly COVID update. I've got a lot to share today. This is September 1st, 2022. I'm going to, as usual, share my screen. I'm just going to go over some of our local data and just look at some of the hospitalizations and trends. I'll go directly to some of the graphs here, and you can see that we're on our way down. So again, hopefully that'll be a trend downwards, which again, I think is because we're on the other side of the wave, kind of going downwards. If we're looking at our percent positivity, that too has gone down significantly from July, but it's still flattened out or between 9 and 10%. If we're looking at our outbreaks as well, the outbreak numbers have also started to decrease. You could see a sharp decrease here over the last week or so, and so that's going in the right direction. And when we're looking at our wastewater levels, if we look at Cornwall, you could see that we've started flattened down, and so we do expect a week or two lag of hospitalizations to go down as well. So I think that's what we're seeing right now. We're also seeing flattening down in Hawkesbury. We're also seeing flattening down again, a bit up, and then flattening in the Castleman area, and same, a sharp rise and then a decrease and a flattening in the Morrisburg area. So that just tells us, and in terms of our cases, our case numbers are among the lowest in Ontario right now. We're still getting cases, but not nearly as many as we had in April or even in the peak of July, middle of July. And so that is good news for us. But again, we still have levels of high positivity in our area. But again, I think it's going down, which is a good thing. I'm just going to go over some of the vaccines right now. In terms of our numbers, and you could see again, usually what we're seeing is higher percentage of the elderly, particularly first, second, and third dose. The fourth dose is almost at 70% at 80 plus, and you could see the green dose, the green number bar here is the fourth dose. So you could see it's low among the 60 and very low among everybody else. But the third dose is the one that, to me, that people need to be aware of. There's going to be, like I said, look at the third dose in 50, 60-year-olds, quite low here. And so if we're looking at a third dose among young people, we're basically less than 67, 65%, actually more than that, 65% or so have not received the third dose. And again, the third dose booster really increases your protection, and that's very important. I will be talking about vaccines a bit later as I summarize some of the new things that are developing and some of the things that we would be expecting to see in over the next couple of days, and particularly now with the new guidelines that were released yesterday and some of the new vaccine announcements that were made yesterday. So I'm going to summarize those in a slide presentation that I put together. So let me start first by saying that the government has now changed some of the recommendations of if you have a positive case, or if you have been in contact with a positive COVID individual. Before you'd have to isolate for up to 5 days. Right now, there's been a change to that, and I want to sort of contextualize that, and we'll talk a bit more about that later on in terms of the context. But we are in a different place right now. We've had many people who have had community immunity. Either they've got it through the infection or a combination of vaccines or just vaccines, high levels of immunity. We're seeing a decrease in hospitalizations and decreased deaths among the vulnerable population. And we're also seeing we also have tools right now that allow us to treat individuals who are at risk for complications, the antiviral medications. So all that, plus the fact that we have now removed most of the restrictions, as you know, no masking or anything like that. And, last 2 years in the fall, all we saw was COVID. Because of all the restrictions, we didn't have the usual respiratory viruses that come around, in the winter months, like flu, other cold viruses, RSV, and so on. So it was just a COVID. This year is going to be different because we do have there's going to be, we've already seen it. We had flu in May and June. Flu is going to come back. Flu came quite strongly in Australia when they had their winter. We're going to have, in addition to some COVID surges, we're also going to have respiratory surges. Okay, so now we're going to put those together, and all of those are prevented the same way in terms of some of the precautions you need to take, particularly when you're symptomatic. And so what we're going to be saying right now is individuals who have COVID symptoms, whether they test positive or not, should stay at home, and there's no kind of period of 5 or 6 days. You need to stay home regardless of the testing results, okay? And until your symptoms have resolved, and I'll give you a detail on that. But the important thing is, once your symptoms have resolved within a 24-hour period or 48-hour periods, if you have gastro symptoms, you need to continue to wear a mask for 10 days from the time you started to get sick, and avoid visiting individuals who are vulnerable in high risk settings. So what does stay at home mean if you're sick? And basically, I just want to spend a bit of time on that, and then underscore some of the other important factors. So, for example, if you have to stay home, you develop the symptoms, you need to stay home until your symptoms have resolved for at least 24 hours. In other words, you're getting better, you're improving, and you feel better, but it has to take 24 hours. You're good, and then you can go back to work or go back to school and so on. It's 48 hours if you had a gastro. So 48 hours after you're feeling better, after you've had gastro symptoms, gastrointestinal, diarrhea, vomiting, and so on. Important, very important, is that after isolating. So let's say you've isolated, and the thing is that, a lot of people have been saying, well, why did you change the 5 days? Well, we didn't really change 5 days per se. We just changed the amount of time that you're ill. Don't forget that initially the COVID virus, the original one, had a 14-day incubation period. Once you were exposed to it, you can get sick 14 days later. The incubation period, in other words, the time between you're exposed to the Omicron B4, B5, and the time you develop symptoms is 3 days. So that's very quick. And so so once you get sick, so let's say somebody gets sick on a Monday, usually the symptoms last a couple of days, 2-3 days, and then starting to feel better the 4th day. So you go back to the 5th day. So it's almost the same. However, if your symptoms last longer, if you get 5-day symptoms, then you got to wait. You're isolating for 6 days. So it's important. That's why there's a give and take in that, depending on how quickly you resolve. However, important, and again, I'll stress that again, after you isolate, you need to, when you go back to the public and you go back to work, go back to school, you need to wear a mask, because that mask protects others from you in case you shed the virus. And I will talk about masking specifically a bit later. Again, you're going to avoid non-essential visits to vulnerable individuals. And this is regardless of whether you've been tested or not. And this applies to all respiratory viruses, because they have similar symptoms as we move forward. The other thing, too, is make sure that if you're eligible for COVID treatment, like antiviral treatment, make sure that you're eligible and get tested and get treated. And again, that's quite important. So now let's talk about some of the other scenarios. So individuals who test positive but have no symptoms. So they needed to isolate, but right now, they no longer require isolation if they have no symptoms, but they need to mask for 10 days, and obviously avoid high risk settings and so on. This, what I'm telling you right now, applies to the general population. There's a bit of a different guidance for people working in healthcare and high risk settings, but I'm just covering what's going on in the high risk in the average in the population that's not in high risk. Then this also is a change as well. Individuals who are close contacts. So let's say now you live with somebody who's got COVID. In the past, you'd have to isolate at home. However, right now you don't need to quarantine regardless of your vaccination status. However, so you can go to work, go to school, but you need to wear your mask for 10 days of the last exposure, and again, avoid visiting vulnerable people. But of course, if you develop symptoms, you need to isolate, of course, and the same is for people who are asymptomatic positives. If they develop symptoms, they need to isolate, and as I described above. And so that's quite important to know. So that's a change. And again, that reflects our changing understanding of the virus, changing of the way that how quickly the virus spreads, and understanding it a bit better, and knowing again what we have in the community, and knowing that it's not only going to be the COVID virus giving us symptoms that are contagious, but it's also going to be the flu, it's also going to be RSV and the other ones. And again, that's another reason why, in addition to keeping up with your vaccines, which I'll talk about a bit later, it's also important to get your flu shot this year as well. So I want to talk a bit about the masking, because we still recommend masking in crowded indoor places, particularly if you're vulnerable or if you're vulnerable individuals. But again, the masking takes on a different role right now. It had the two roles, but the reason we're masking now, if you're symptomatic or are post, you've got COVID and you isolate, and then you mask for another 5 days, or whatever, for a total of 10 days since your symptoms started. There are two purposes for masks, okay? One is what's called source protection. In other words, I'm blocked here, so I can't spread the virus, okay? So it's a source protection, and that prevents me, the wearer of the mask, from spreading the virus to others. So it protects others. That's one role of the mask. The other role of the mask is that it protects the wearer from getting the infection. Now, so there are two good reasons for wearing masks. However, in the context of an individual who, is going in a setting where masks are not mandatory. However, if that individual himself or herself, is recovering from COVID or COVID-like symptoms and needs to mask for a couple of days, that individual is wearing it really to protect others around them, in case that individual sheds the virus, which is unlikely. The longer you are post your first symptoms, the less likely you will shed it. And even if you're vaccinated, it's even less that you will shed it. But this is just to protect everyone around them. So that's important. So the recommendation is, in general, masking is recommended in closed places, particularly if you're around vulnerable individuals, or if you feel vulnerable yourself. And again, we should be accepting people's choices one way or the other. Will there be a mandated masking? Perhaps, if there is a big surge in the fall or in the winter months, but that's something that's not now. Right now, we're seeing that this approach, I think, is a reasonable one. And so that's, to me, important. People ask me all the time, but there are two different reasons. So if you'll see people now, because of the new guidance, working with masks on, it might likely be because they are just wearing the mask to protect others because they've had COVID, or they've had COVID and now are asymptomatic and need it for the full 10 days, or they are living with close contacts, and so on. So that's quite important to understand the nuances of the masking. But in general, if you haven't got COVID, if you're not sick, but if you're vulnerable or if you're uncomfortable, wear a mask. So that's my recommendation, and I'm comfortable with that approach going to school as well. At this point, there's really not any restrictions in schools. This is the fourth school year that is being affected by the pandemic, and some children have never seen what normal is like. They started school in kindergarten during the pandemic, for example, and so they've not had the normal experience, the normal socializing, the normal engaging with others, the development of peers, the academic. They have not had that. They need that, and we've had mental health effects in these children as well in the population. Of course, everybody's fatigued, but in children especially, they're vulnerable. So to me, the effects of risks, putting restrictions on them, mandating more things now to them, it actually is a higher risk of making those developmental challenges and problems worse than actually COVID itself in this situation. Again, the context today is different. We have community immunity, we have antivirals, and we are doing enough we have a lot of tools in our toolkit right now to prevent the vulnerable people and our healthcare system as well. So again, the other thing too is COVID is usually milder in children, but it can be serious. And that's why we recommend COVID vaccines to prevent serious illness and long COVID. Vaccines have been shown to do both. and especially among younger children. And we also have in school multiple layers of protection, which include, screening, hand hygiene, staying home when you're sick, heightened ventilation, and of course, vaccination. So those are the things that we're dealing with. A lot of people have asked me about my opinion about kids going back to school as a pediatrician, and I can tell you as a pediatrician, we need to provide children a return to school as normal as possible at this point. Again, I stress this is the fourth academic school year under the pandemic. And finally, I just wanted to just give you a bit of an update of COVID vaccination. I showed you our rates. We need to be up to date. It's important to get your third dose or your fourth dose, depending on your situation. And what was newly announced yesterday, as of today, a third dose booster is now available for 5 to 11-year-olds. I note that in our area, only 30% of the 5 to 11-year-olds have received a second dose. So I encourage them to go and get their third dose, particularly if they have underlying medical conditions. Half have got their first dose only. So again, I encourage parents to keep their children up to date. We also have now the 6-month to 4-year-old vaccine available. Not much uptake there, less than 4% locally and provincially. And I believe today there will be an announcement that the bivalent Omicron-specific vaccine is imminently going to be released, approved and released in Canada. This is a vaccine that I think will likely have a good potential to really stop the spread of COVID in the community as well. This is a vaccine that contains 2 strains, the original strain that's in the current vaccine and an Omicron-specific B1 strain that we believe will have much better ability to prevent Omicron, including B4 and B5, from spreading from one person to another. And that's quite important, because if you can prevent the spread at the same time preventing severe disease, you're actually limiting the amount of people that the virus can infect. And as such, you're actually reducing the ability for the virus to be around, and it'll fizzle out, and that will mark the end of the beginning of the end of the pandemic. So, having said that, again, a lot of changes, but more towards normalcy, more towards, the virus becoming part of our usual respiratory viruses, recognizing again that, we've come a long way. Again, we do have those tools, and I encourage people to, use the tools, look at the new guidelines, practice the new guidelines. If you're sick, stay at home, follow those guidelines. If you go back to work, go back to school, wear the mask. Don't bully people who wear masks. Don't, judge people. It's their opinion. It's their life, and so on. But also recognize that there will be people going to work with masks to protect you because they have been in contact or they're asymptomatic, and so on. So again, once again, thank you very much, and I'll talk to you next time.